Here's a bill that could wipe out years of careful super planning. A single medical evacuation from Vietnam can cost $78,000 to $150,000 US, sometimes more. And here's the part most retirement videos never mention. Medicare doesn't just reduce coverage when you move to Vietnam. It covers absolutely nothing. In this video, I'm going to walk you through exactly what healthcare costs in Vietnam, what your real insurance options are, and how to protect yourself properly with real 2026 numbers. Australia has reciprocal healthcare agreements with 11 countries, places like the UK, New Zealand, Italy, and Ireland, where you can walk into a public hospital and get treated the way you would at home. Vietnam is not one of them. That means the moment you land in Vietnam, you are 100% self-funded for any medical cost, from a routine GP visit to major surgery. There is no Medicare safety net at all. So what does that actually look like in dollar terms? Let's use Da Nang, since it's the most popular retiree base on this channel. There are broadly 3 tiers of care. At the premium end, family medical practice, a Western Standard International clinic, charges $86 to $110 US for a standard GP consultation. Vinmec Da Nang, a large modern private hospital, sits in the middle at around $47 for the same visit. And Huan My, a well-regarded but more locally priced hospital, comes in around $24. That pattern holds across the board. A full blood panel ranges from $20 at the budget end up to $120 at the premium end. An overnight hospital admission runs $30 to $70 at Huan My, $50 to $120 at Vinmec, and $80 to $150 at family medical practice. And an emergency room visit, the one you can't really shop around for in the moment, runs $50 to $80 on the low end and $150 or more at the premium clinics. One more category worth knowing, because it catches people off guard: dental. A root canal in Da Nang runs $100 to $250. A crown is $200 to $400. Even a full implant, which can run several $1,000s in Australia, is typically $500 to $1,000 here. This is a big part of why some retirees factor dental savings into their overall Vietnam budget. So if Medicare is zero help, what are your actual insurance options? Broadly, 4 tiers. Local Vietnamese insurers, Bao Viet, Liberty Vietnam, Pacific Cross, are the cheapest, running $300 to $600 a year, but typically have limited English language support and may not cover evacuation. Regional Asia plans from providers like April International or Luma Health sit at $600 to $1,200 a year and usually add medical evacuation within the region. Full international global plans, Cigna Global, Bupa Global, Allianz Care, start around $1,500 and can run $5,500 or more a year, especially once you're in the 60 to 65 age bracket, where comprehensive international coverage averages $4,500 to $7,500 annually. And then there's a category built specifically for people living outside their home country long-term. That's where something like SafetyWing fits in. It's designed for exactly this situation: long-term expats and retirees, not short-term holidaymakers. Pricing is age-banded and billed every 4 weeks. If you're in your 50s, it's around $145 per 4-week cycle. Call it roughly $1,400 a year. In your 60s, it's about $197 per cycle, or around $2,400 a year. What you get for that? A $250,000 medical coverage limit, a genuinely important $100,000 medical evacuation limit, remember that evacuation number from the start of this video, and zero deductible, meaning there's no out-of-pocket threshold before it starts paying. It's worth being clear-eyed about what it doesn't cover on the standard plan. Routine checkups, adventure sports injuries, and mental health treatment are excluded. So if you have an ongoing condition, read the policy wording carefully or look at a full international plan instead. I'll put a link to SafetyWing in the description if you want to compare the numbers yourself. Let's put this together with a real scenario. Say you're 62, living in Da Nang, generally healthy. A SafetyWing style plan in that bracket runs close to $2,000 a year, roughly $170 a month. Compare that to a single unplanned emergency room visit and overnight admission at the premium end. That's $150 for the ER, plus up to $150 for the admission. So $300 in one bad night, without insurance. Now compare that to the number we opened with. A genuine medical evacuation, the kind you hope never happens, at $78,000 to $150,000. 1 year of insurance costs less than 3 bad nights in hospital would cost you without it. And it's a rounding error next to what an evacuation would cost if you needed one. A few things this video doesn't cover because they need their own deep dive. First, pre-existing conditions. Most plans, SafetyWing included, have waiting periods or exclusions here, so read the fine print based on your own health history. Second, prescription medication. Many common medications are actually cheaper and available over the counter in Vietnam, but that's genuinely a topic for its own video. And third, this is general information, not personal advice. Insurance needs vary enormously based on your actual health, so speak with an insurance broker or the provider directly before you commit. So, is Medicare a factor once you retire in Vietnam? No, not at all, and that surprises a lot of people. But the actual cost of protecting yourself properly is a lot more manageable than the headline evacuation numbers make it sound. If this was useful, subscribe. Next up, we're going deeper on prescription medication costs and what's actually available over the counter. And drop a comment. Have you already sorted your health insurance for Vietnam, or is this still on your to-do list? As always, general information only, not financial, medical, or insurance advice. All links and sources are in the description below.